Big toe arthritis is also known as Hallux Rigidus, meaning that your big toe is stiff. It's a Latin word of rigidus, meaning stiffness in the big toe. The underlying cause of Hallux Rigidus is essentially osteoarthritis of the big toe. It is monoarthritis, which means it's not a systemic arthritis, but affects only one joint at a time. The cartilage in the big toe joint wears down slowly, causing enlargement of the joint, gradual stiffness, and increasing amount of pain and discomfort and limitations in activity. The joints can be assessed clinically in that usually you would have 70 to 90 degrees of extension or upward movement and 20 to 30 degrees of flexion, and loss of that movement is an indication of developing osteoarthritis or degenerative changes within the joint. It can easily be assessed with x-rays, but occasionally in the early stages or stages that are not that clear, we require MRI scans to assess the cartilage health. You can use ultrasound to look at whether there's any joint swelling or sign of itis or inflammation of the capsule, which is resulting in the symptoms. In the early stages, with conservative management, one can try to modify their footwear so they wear more rigid sole shoes, wear insoles with some extension around the big toe to support the big toe better. Other treatments may include injections such as hyaluronic acid or PRP to help improve the health of the joint. If there is a lot of inflammation, a steroid may be augmented into the treatment to reduce some of the inflammation within the joint. One of the common presentations is a bone spur, where a bone spur develops on top of the joint, limiting the extension of the joint and pinching on extension. This bone spur can cause footwear problems or pain as soon as you extend the toe. In such a situation, we perform a procedure known as the chylectomy procedure. The bone spur is removed. This can be performed through keyhole technique in a lot of cases where there is a small incision made to clean the joint and clear the bone spur. It has a place in very early arthritis where there is not much damage to the cartilage, but the bone spur itself is causing the problem. In advanced stages of arthritis, where chylectomy or other conservative treatment has failed, you may require either a joint replacement or fusion. A joint replacement will replace the big toe joint completely, but is not suitable for the younger patient groups who are very active, as it will wear down over a decade and therefore require further surgeries. However, in the elderly patient who want to maintain some mobility and want a quick return to activity and shoes, this may be a viable option. Fusion is considered gold standard. This essentially reduces all the movement in the joint, but no movement results in no pain. Patients often will load better into the big toe joint after a fusion as they get used to walking on the outside of the foot because of big toe joint pain. Studies have shown that the big toe function in terms of loading of the foot overall improves with the fusion. It requires 6 to 8 weeks of recovery and rehabilitation. It is a highly successful procedure performed in the right patient. We have a range of options and innovative treatments available for Hallux Rigidus or stiff big toes. Please get in touch with our clinic and we will help you where we can.